the PROUD and continuation PV studies was a randomized study started in Europe a few years ago that first compared in the PROUD PV head-to-head this new formulation of interferon alpha-2b, the ROPEG interferon alpha-2b, to standard treatment, which is hydroxyurea. Patients were randomized 1-to-1 to receive one of these drugs, and to enter the study, patients had to have polycythemia vera in need of a therapy that could be a high-risk disease, for example, patients older than 60 years old, or patients who had experienced previously a thrombotic event, or patients who really required a treatment because they had symptoms, they had too many phlebotomies, etc. Then these patients, after the endpoint of the PROUD PV study was after 1 year to compare the efficacy of two drugs, and then patients could roll over to the continuation PV study, which is the follow-up study for these patients who remain on their treatment with ROPEG on the main investigational arm, compared to the others who could switch of treatment, but in fact, almost 95% of patients remain on hydroxyurea. And what we presented at ASH 2020 was the results after 5 years of follow-up in these studies. So the main results were first to show the durability of response, because we still had almost 56% of patients in complete hematological response, meaning that they had an hematocrit below 45% without any phlebotomy for at least 3 months, normal platelet counts, normal leukocyte counts. And so the proportion of patients reaching this complete hematological response was 56% after 5 years in continuation PV study in the ROPEG arm, compared to 44% only